క్యాన్సర్ వచ్చిన తర్వాత వాళ్ళకి ట్రీట్మెంట్ అయిపోయిన తర్వాత పిల్లల్ని కనాలనుకుంటే కనొచ్చా ఐవీఎఫ్ ద్వారా?
In 2010, we did the first sperm preservation for a cancer for a person, and at that time he was 16 years old, and we preserved the sample. We did not charge anything. Then in 2022, I think, he came back married with 2 years of married life. We did an IVF from the sperms we frozen, and he has a healthy child.
నమస్తే డాక్టర్ గారు.
నమస్తే అమ్మా, ఎలా ఉన్నారు?
నేను బాగున్నానండి.
ఐఎమ్ గ్రేట్ అమ్మా.
థ్యాంక్ యూ అండ్ నైస్ టు సీ యూ బ్యాక్. సార్, ఈవేళ టాపిక్ మనం మామూలుగా క్యాన్సర్ అండ్ ఐవీఎఫ్. క్యాన్సర్ గురించి ఎందుకు మాట్లాడదాము అనుకుంటున్నానంటే, పూర్వం క్యాన్సర్ ఎవరికో ఉండేది. ఇప్పుడు చాలా ఎవ్రీ 1 in 3 to 4 హౌస్ హోల్డ్స్ ఒక క్యాన్సర్ పేషెంట్ వింటున్నాం. అయితే క్యాన్సర్ చాలా యంగ్ ఏజ్లో రావడం కూడా ఇప్పుడు జరుగుతుంది. పిల్లలకి వస్తుంది, మిడిల్ ఏజ్ వాళ్ళకి వస్తుంది. క్యాన్సర్ వచ్చిన తర్వాత వాళ్ళకి ట్రీట్మెంట్ అయిపోయిన తర్వాత పిల్లల్ని కనాలనుకుంటే కనొచ్చా ఐవీఎఫ్ ద్వారా?
Certain circumstances, the answer is yes. I'll explain why. The first thing is, our quality of healthcare is improved. They're able to pick up cancer at an earlier point. At an younger age, cancers వస్తే they're able to diagnose them at an earlier point. That's a major difference between 2015 to 2025. Prior to 2012, the scenario is completely different. Then, when we are diagnosing them early, with advancement of chemotherapies, their ability to survive and grow into adults is becoming high. So when there is an ability to go beyond life and the possibility of a marriage, then the possibility of procreation comes in. 30 years back, it became a rarity. Now, the guideline says if a person is unmarried or does not have a children, whether male or female, depending on the type of the cancer, the oncologist or the oncosurgeon should offer them that there is something called fertility preservation, and that choice is left to the couple, but they should be informed. In the information, how much of time is there? It is not for advanced terminal cancers. It is for early stage cancers where the chance of their survival to become adults and normal life possibility unnolke. This is the context, because there is no point in having a child without a mother or without a father. And I'll tell you one thing, we did not publicize it. In 2010, we did the first sperm preservation for a cancer for a person, and at that time he was 16 years old, and we preserved the sample. We did not charge anything. Then in 2022, I think, he came back married with 2 years of married life. We did an IVF from the sperms we frozen, and he has a healthy child.
Wow.
So, we are pioneers in మేము కృష్ణ ఐవిఎఫ్ ఎంబ్రియో ఫ్రీజింగ్లో కానీ స్పర్మ్ ఫ్రీజింగ్లో కానీ లాట్ ఆఫ్ రీసెర్చ్ వర్క్ చేస్తుంది. ఈ రీసెర్చ్ వర్క్ 2004లో స్టార్ట్ అయింది. ఇన్ఫ్యాక్ట్ 2006-07లో పబ్లికేషన్లో మేము, జపనీస్, కెనడియన్స్, ఆల్ 3 of us published the same thing, vitrification, in the same year.
Research done by primary researcher Krishna IVF.
At the same year, it was done in Japan. In the same year, it was done in Canada. All three of us published those results in the same year. It's only a question of months. And that is there in the journals, in every textbook.
In
it is
medicine
there.
textbooks?
Yes.
Okay.
So, in any reproductive medicine book, if they search vitrification, embryos, Krishna IVF, that citation comes in.
జనరల్ పబ్లిక్ ఈ విషయం తెలియదు కదా డాక్టర్ గారు.
చెప్పుకోలేదండి, మరి చెప్పుకోవడం తెలియదేమో మాకు. బట్ వన్ థింగ్ ఈస్ వీ షేర్ దిస్ నాలెడ్జ్ అక్రాస్ ఇండియా.
డాక్టర్స్కి,
అదర్ ఐవీఎఫ్ క్లినిక్స్,
మెడికల్ ఫ్రెటర్నిటీ.
fraternity. RR hospital, which is the army hospital, the in charge person by name Talwar came here. RR hospital is the government of India's IVF hospital for military personnel, which is based in Delhi. We shared our knowledge through 3 teams from them. Then we had people coming from Bombay who are prominent star people. But to respect the thing, we share the knowledge. We had the people from Gujarat. In fact, we had even people from Iraq, Romania, and United Kingdom, Malaysia, 2-3 batches. There's Malaysia National Hospital, the current team, and some of the senior embryologists. We shared our knowledge. That I'm happy to share. Because of that expertise, this boy came. We freeze it. We have frozen it, but we did not take any money. The reason is we did not know how long to keep it. Then second thing is, since reproductive law was not there, what if something happens? What is the law to discard it was not there. Because India reproductive law came in only in 2022. And once in 2 years we used to call them up to see whether he is healthy or not. We kept the sample. Then once he became an adult, at 24-25 he got married, and within 6 months he came for IVF. Luckily he conceived in the first cycle. We felt we should respect his privacy rather than using for publicity.
అదే వేరే, అంటే ఐ షుడ్ నాట్ బి పాయింటింగ్ అవుట్, బట్ వేరే క్లినిక్స్ అయితే దే వుడ్ హ్యావ్ బ్లోన్ ఇట్ అప్ ఇన్ ఏ హ్యూజ్ ప్రపోర్షన్.
True, but why should somebody know he had cancer?
Yes.
Why should somebody know that he had IVF? That's a personal thing. And there's a difference between scientific reporting and media reporting.
Yes.
And saying this facility is available is different. Using somebody to promote yourself is a gray zone in medicine. That's each person has to take that individual call.
డాక్టర్ గారు, ఇందాక మీరు ఒక పాయింట్ చెప్పారు, వాళ్ళకి లైఫ్ స్పాన్ ఉంది అంటే ఆ తర్వాత ఐవీఎఫ్ అని. ఒకసారి క్యాన్సర్ వచ్చిన తర్వాత న్యాచురల్ కన్సీవింగ్, ఈవెన్ లైఫ్ స్పాన్ ఉంది, ట్రీట్మెంట్ అయిపోయింది, న్యాచురల్ కన్సీవింగ్ పాసిబుల్ అండి?
అంటే బేసికలీ వాట్ హ్యాపెన్స్ ఇస్, if there is radiotherapy, the ovaries and the testes will get destroyed.
Oh.
If chemotherapy, sperm production will get disturbed or stopped, permanently or temporarily. The number of eggs available can be completely destroyed or reduced.
Oh.
And then on that, whether she needs surgery, if the surgery involves removal of the ovary or the testis to save the life, but retaining the uterus if it's not uterine cancer. And second thing is, if a chemotherapy is given, it's not given locally, it's given to entire body. So the concepts of freezing is After the onset of becoming adolescent, that means the menarche or the adulthood, there you can pick up eggs and sperm.
Okay.
But there is also a concept, cancer in a child. There the ovarian tissue and the testicular tissue is taken and frozen, because at this moment the technology is very inefficient. But you can't get eggs and sperms there, so they take a biopsy and freeze it.
Oh, uterine tissue కూడా freeze
No,
చేయరు.
ovarian tissue. Suppose a girl of 8 years is there which needs a chemotherapy, or needs a removal of the ovary. They because since the eggs are not started forming, they freeze the ovarian tissue freezing. And then after when the child becomes adult, decides to marry, the tissue in vitro culture lo chestaru, but at this moment the babies are born, but it's not a very efficient procedure.
Okay.
Similarly, boys kuda extract a sperm. So the role of fertility preservation happens in cancer, but it also happens in endometriosis, which not many people are aware of.
డాక్టర్ గారు ఒక క్వశ్చన్, ఇప్పుడు మ్, ఒక బేబీకి డెలివరీ ఇచ్చింది ఒక ఆమె, బేబీ రియల్గా జరిగింది. డెలివరీ అయ్యి ఒక పాప పుట్టి కనీసం ఒక 7 months 8 months అయింది, క్యాన్సర్ సెకండ్ స్టేజ్ అని డిటెక్ట్ అయింది, రియల్ కేస్. ఇలాంటి సిచ్యువేషన్లో తర్వాత మదర్ ఒక 10 years సర్వైవ్ అయింది. ఇలాంటి సిచ్యువేషన్లో బేబీ మీద ఏమన్నా క్యాన్సర్
అంటే ఏమవుతుంది,
ప్రభావం ఉండొచ్చా?
ఈజ్ ఇట్ జెనెటికలీ రిలేటెడ్ క్యాన్సర్ ఆర్ నాన్ జెనెటికలీ రిలేటెడ్ క్యాన్సర్? సో ఇది జెనెటికలీ రిలేటెడ్ క్యాన్సర్, సపోజ్ బ్రెస్ట్ క్యాన్సర్ ఉందనుకోండి, బిఆర్సి యాంటీజెన్ పాజిటివ్ ఉందనుకోండి, then the child might have a risk for cancer when she becomes 50 years or 60 years.
Okay.
Similarly, colon cancers ఉంటాయి.
This was a colon cancer.
Some certain colon cancers ఉన్నాయనుకోండి, she has a risk of inheritance at a particular age.
Okay.
Then she goes for annual screening after a certain age, which guidelines are there by the Endocrine Society of America, how often they should have a screening, so that the cancer is detected early, at a very very early stage, and treated. So
వాళ్ళు అలాంటి పిల్లలు ఎప్పటి నుంచి స్క్రీనింగ్ ఫస్ట్ టైం?
and my knowledge is not adequate because that's a rapidly changing area. But one thing is, first thing is it should be verified whether it's a genetically related cancer or not genetically related, and that particular gene association కాకుండా cause gene ఉంటేనే then all these are needed. In future, I expect there will be the bigger units who are the legacy units will practice high quality fertility preservation. Second thing is, these embryos of oocytes or sperms are frozen at -197 degrees centigrade. But one thing is, every storage has its own risks of accidents, of damage, or a blow up of the can be also possible. In fact, couple of years back in Cleveland, Ohio clinic, 4,000 units of numbers of oocytes and embryos were lost because there was a tank failure. So one should not take fertility preservation as foolproof. It is an option and a facility available with all the risks associated with a life. With a life, you can't predict a motorcycle will hit you when you cross the road. Similarly, freak things can happen. So when you are postponing a pregnancy, have a valid reason. Because you're thinking they're put in a box, in a container, in a storage. These are kept in a liquid nitrogen which needs constant filling up and monitoring that the tank's temperature is appropriate and the tanks are filled up. And imagine that state of floods which are happening in many cities of the country. If the flood is coming to the first floor and the clinic is in the ground floor, what happens to the embryos? We never think about that aspect. So, in a preservation, it's an option and use it at the earliest possible thing.
డాక్టర్ గారు ఇందాక మీరు ఒక మాట అన్నారు, 16 years అబ్బాయి. సో వాట్ ఇఫ్ తను మ్యారేజ్ చేసుకున్నాడు, వచ్చాడు, బట్ వాట్ ఇఫ్ ఇన్ చాలా ది అదర్ సైడ్ ఆఫ్ ది కాయిన్ హీ డెంట్ సర్వైవ్?
We took a consent that if he passes away, we will discard the sample.
ఓకే.
We took that consent.
ఓకే.
Now the guidelines have forms for that, but at the time there were no forms. We took a consent. Why we did not take the money is when money is there, legality is involved. Even when money is not there, legality is still involved.
You are not bound.
At least the courts will take a lenient view because that's a grey zone, and we are able to help somebody. The power of help and power of giving. When somebody is drowning in life, gives for them a hope to live. That was the motto. On that motto we did it. Because when the facilities are available, what's the problem with me? It gives him a hope to live, and it also gives him a hope that because he may not believe the doctor that he's going to live, he has own doubts. When his genetic material is frozen, he knows that his possibility of survivals are there. That's the reason they're freezing the sample. Also look from that time. But it should be done for the right person as survival, not for the person as a placebo.
సో ఇప్పుడు మీరు చెప్పిన విషయాన్ని పెట్టుకుని
And the good thing is
ఎవరైనా ఎక్స్ప్లాయిట్ చేసి అవును ఉంది మేము చేసిస్తాము జస్ట్ ఫర్ ది కేస్, అలా కూడా
I'll tell you an example. How we are on the opposite side, there are 4 people, and here we are 2 people. How many of us remember Global Trust Bank? Now we are forgetting Andhra Bank.
ఎస్ స్లోలీ
Global Trust Bank?
నాకు గుర్తుంది సార్, ఎందుకంటే జీటీబీ ఇక్కడ మన ఆసిల్మెట్లో ఉండేది.
Similarly, a clinic might disappear. Then where will they go? The government said to surrender the tissue to the government. But who will fill the liquid nitrogen in the tank? It involves money. When we are not a rich, prosperous country and where we are suffering to run the country, then it has own logistic limitations.
సార్ ఇప్పుడు ఆ అబ్బాయి ఆ ఏజ్ ఆ కేసులో, కానీ ఒక 22-23 వాళ్ళకి క్యాన్సర్ వచ్చింది, బట్ లేటర్ దే గాట్ క్యూర్డ్, పెళ్ళయింది. కానీ వాళ్ళకున్న ఒకే ఒక్క ఆల్టర్నేటివ్ ఐవీఎఫ్ లేకపోతే
Only IVF, because what happens is because we frozen only 1 million sperms, and if I do an IUI, my sample is over. The chances are over. Most of the time, fertility preservation needs assisted reproduction. It's again a double-edged sword. Somebody had recently Hodgkin's lymphoma, and the cost of chemotherapy was 25 lakhs. And that couple felt they will forego fertility preservation because it is adding burden to the family. And the girl felt, I already adding burden to the parents, why do I need this? But we took an initiative and supported her. We're happy for that. But don't ask anything more than that because their privacy will be respected.
ఎస్.
The reason why I'm saying that is This should not be, people should not think if needed, edit it off. People should not think this is one form of promotion. I'm only sharing what we did.
Yeah, that problem is, forget about promotion, Dr. Garu. Problem is, others should not take a cue and take it to their advantage
They will
to
also,
exploit patients.
అలా కాదండి, even other patients will exploit us. And imagine a situation where if you are using the best of products, most of them are imported. And in that situation, imagine the way our rupee is galloping up to 100. And the price of the imported products also gallop up to the 100. So, Indian IVF industry is in crossroads in many ways. One is best quality equipment. The prices are increasing. The consumables are increasing. Second thing is, people do not know which is a good or a bad clinic. The third thing is, the IVF procedure itself does not give one cycle 100% effort. It only gives around 40% live birth on a consistent basis, depending on the age of which of the patients are coming in. The best thing is the recent introduction by the guidelines of the ART Surrogacy Board to report all the data from 2022 January is a big step forward to improve the quality of the industry. That will help many people so that they can go and search the portal and look at the information in their own privacy.
This is a very breakthrough decision by government.
Yes, I applaud it.
Yes, Doctor. As general public, we also need to support and applaud it. బికాస్ ఐవీఎఫ్లో చాలా ప్రూఫ్స్ ఉన్నాయి, ర్యాకెట్స్ పట్టుకున్నారు. ఇలాంటి సినారియోలో అలాంటి లా చాలా అవసరం.
లా ఉంది,
లా ఉంది, ఎఫెక్టివ్నెస్,
ఇంప్లిమెంటేషన్ ఇస్ they gave a circular couple of days back saying we are giving you 90 days time, and if your clinic was started on the day, your clinic existed on the day the law was there, you are supposed to upload the data from January 2022 till December 2025, including the results.
డాక్టర్ గారు, ఒక్కటి క్యాన్సర్ అండ్ ఐవీఎఫ్ దీని గురించి జనరల్ పబ్లిక్కి అర్థమైనట్టు ఒక 5 పాయింట్లు చెప్పండి డాక్టర్ గారు. క్యాన్సర్ అండ్ ఐవీఎఫ్, క్యాన్సర్ వస్తే ఐవీఎఫ్కి వెళ్ళొచ్చా ఏ సిచ్యువేషన్లో, వచ్చిన తర్వాత ఐవీఎఫ్కి వెళ్ళిన తర్వాత ఛాన్సెస్ ఎంత?
The first thing is, the most important point in earlier, if you have cancer, it is death. Now it is no longer so. So a significant number of cancers have 5 to 10 years survival or 20 years survival rates. Especially childhood and adolescent cancers, they have 40 to 50 years survival rates. That means they are able to go into adults. So in that group, reproduction is possible. Second thing is, once you are diagnosed with the cancer, if it is early stage cancer, then preserving your genetic material, because the chemotherapy and the radiation that is involved either in the male or the female is destroyed, because one of the most sensitive organ in reproduction is the testis and the ovary, for chemicals, for radiation, for medicines. So if you have early stage cancers, late stage cancers low, when your survival rate is doubtful at all, their fertility preservation does not have a meaning. You are adding another burden. The third thing is the clinic capable of handling it? and working 7 days a week because you have only a small window of 4 to 8 weeks of time from the time you are diagnosed with cancer and the surgery to the start of chemotherapy. Is the clinic willing to work and support you in all days so that your treatment is not delayed and completed in that window without compromising is the key part. Second thing is how robust is the identification of the genetic material and traceability and trackability of the genetic material. Does it exist in that particular clinic? Last but not the least is will the clinic exist 5 years later? The clinic does not exist. It's like the bank which moves away. That's also an important concept. It means we appreciate your crisis, but we also want you not to get exploited, not to spend money unnecessarily, but in a feasible situations, depending on your oncologist and the reproductive medicine joint consultation, make a decision. It is possible. Then take that information and then discuss with your family in a quick way and make a decision. That's my advice.
అండ్ డాక్టర్ గారు ఇట్స్ మీరు ఒక కేసులో మీరు చార్జ్ చేయలేదు, అది దట్స్ యువర్ గ్రేట్నెస్, బట్ ఇట్ ఈజ్ అన్ ఎక్స్పెన్సివ్ ప్రొసీడియర్, రైట్?
Expensive, legally complicated procedure.
ఓకే.
It may not be expensive. Maybe sperm freezing is not expensive,
ఓకే.
but the legal responsibility of a loss or a damage is beyond the control. If they go to court, it is legally expensive and litigation expensive. That's another dimension which people don't think.
లీగల్గా సూ చేయాలన్నా కూడా భయమే కదండి.
భయం లేదండి.
There should not be lawyers also who do not exploit the patient.
లేదండి, they're doing the job. They say unless proven guilty is innocent.
థ్యాంక్ యూ డాక్టర్ గారు.
Namaste, it's wonderful, and I wish cancer should decrease first, and identifying good chemotherapy units is the priority. Then only selecting fertility preservation, and whether asked directly how and why is it useful, and how and why is it does not destroy the therapy, and what is your experience.
థ్యాంక్ యూ డాక్టర్ గారు.